Yeah, so we are live now, ma'am. A very good afternoon to everyone here on the session. I welcome you all for the today's session on Otitis Media in Children by Apollo Cradle. To speak on this topic, I would like to welcome our doctor, Dr. Soumya from Jayanagar. She's an internal consultant. She's a pediatrician working with Apollo Hospital in Jayanagar. To give a brief background about her, she has done her MBBS and DNB in pediatrics. So she is a well-known pediatrician in Apollo Hospital at the Jayanagar Center. We welcome you, doctor, to the session today, and we are looking forward to hear from you on this. Ma'am,
I
all the
agree.
session is all yours. So
Okay.
I'll be there on the background, but please carry on. It's all yours.
Sure,
Thank you,
sure,
ma'am.
sure. Good evening, everyone. I'm Dr. Soumya, consultant pediatrician at Apollo Cradle. Today, my topic is one of the most common disease which we see in our OPD practice. So, I think it will be beneficial for you. Other than upper respiratory infection, the common thing which we see in our practice is otitis media. This otitis means it is infection in the middle ear. Media means middle and otitis means infection. And commonest cause for a child to wake us up at night because of excessive crying is ear pain and ear infections. So I thought it is beneficial for parents to know something about this topic, which is very common. And this, as we have seen, it is 80% of the babies, at least between 1 to 2 years, would have had one or two episodes of the common incidents. Why are children prone? Why not adults? Why don't they get ear infection so often as a child? Is because anatomically, child's ear is not as there is a tube which connects ear and the nose called as eustachian tube that balances our ear pressure. So when we talk, when it opens, and then there is a fluid inside the ear, usually which is produced, which will drain through eustachian tube to your posterior throat. But in children, this eustachian tube is narrower and it is shorter, and the angle with which it opens to the throat is also less compared to the adults. That's why their drainage mechanism is not as well developed as this adults. That's why they are more prone. Apart from that, the risk factors which the child goes through is child's immunity is not as strong as the adult. So immunity is not because it's a developing immunity than the normal baby coming, and male preponderance is more compared to female. Studies have shown male baby is getting more. But one benefit is if they are breastfed, definitely you can cut down the risk of acute otitis media. It is always common in a baby who is bottle fed, because when they are feeding in especially if they are made to sleep flat and they are giving the bottle, it can seep through the eustachian tube to the middle ear. Reverse, there will be negative pressure and that will seep to the inner ear. Other things is there are some families who are prone to the acute otitis media. There are some genetic mutations where there's a common streptococcus pneumoniae, which is a commonest bacteria. Those families are prone. So I've heard if any baby comes with ear infection, commonly they say we have not come to doctor because my son also had, my daughter also had 2-3 episodes they have had, nothing to worry, leave it. Those things I've heard from grandparents. But it's not so. So taking initial steps to stop that is a better option than going to that. Other things which I see commonly is nutritional deficiency babies. So normally if they are well fed, breastfed, healthy babies with good hygiene, good environment, less cases. But if they are ill fed, if malnourished, vitamin A deficiency is there, I have seen more cases of that. And nowadays all parents are working, so they want to leave the kid to a daycare center. Daycare centers are crowded, so many kids get upper respiratory tract infection. Upper respiratory tract infection acts like a seat to the ear infections to breed on, because whenever there is a cold in a baby which is viral or a bacterial, this eustachian tube fluid, which usually drains easily, the tube itself gets swollen up. When it swells up, the drainage which was happening normally is not likely to happen. So in that case, the fluid gets accumulated, and and that fluid acts like a focus for the bacteria to grow. So daycare centers are also a cause for increased incidence of acute otitis media. Another thing is passive smoking. If somebody is smoking, it can also be a cause for concern. The other one we have seen is GER, gastroesophageal reflux babies, because the milk reflexes out each time they are fed and put down. The milk comes back to the throat and sometimes forcefully that it comes through the nose, and then it can seep to the ears also. So gastroesophageal reflex is one of the common thing. Bottle feeding is one which we can easily prevent, and smoking is definitely a crime if somebody is doing in front of the baby. Adenoids is another problem, because as a 2 and 3 year old, if you see your baby breathing through mouth, because there is a gland behind inside the throat, that is nasopharynx. These are like protective glands. When a cold is there, like tonsils, those adenoids also get swollen up. But if they are swollen for a longer time, then again drainage gets affected. That is when they get infected. The other common thing is pacifier. Nobody wants the baby to cry. So even for a few seconds, if the baby cries, they're going to put the pacifier in. That also can act like a focus of infection. So having told you about the risk factors and the common infections, now I'll talk about otitis media. Otitis media means it's a stage where it ends for few days. The fever comes, and ear in pain comes and lasts for some days. There is something called as otitis media with effusion, means there will be some fluid collected in your middle ear. The last one is chronic otitis media with effusion, means it is going to last for many days, keep recurring, and can cause serious issues. So first I'll talk about acute otitis media, and I'll go by age wise. See, acute otitis media common is mostly viral, which usually starts with little cold, and child will start having sneezing just like an upper respiratory infection. And after few days, child will have mild to moderate fever. Suddenly they start crying, because once the middle ear fluid builds up, it puts some pressure on the tympanic membrane, which is the eardrum, and once that is pushed, they get unbearable pain. And in a baby, especially less than 12 weeks, if the baby starts refusing feeding, excessively crying when she's being tried to feed, especially if the baby is fed on right side, and baby, they say baby is trying to feed on left but not on the right, that means they get unbearable pain. In a very small babies, less than 12 weeks, they can also present like lethargy, means unable to get up, they're always sleepy, or excessively irritable, crying, crying, crying incessantly. Whatever you do, feed the baby, console the baby, they're not going to stop, and they'll become lethargic, refusing to feed, sometimes even diarrhea, vomiting. All this can sometimes be. This is turned off. Is it okay? Hello. Then these symptoms are going to be present in the infantile stage. So in infant, if somebody comes with excessive crying, irritability, other than first and foremost we look into is ear problems. So if a baby is noted to have an ear infection in the 3 months infant age group, then we also think of complications are more common in this group. So we also rule out infection in the blood by doing blood investigation, septic viral. Babies usually happens at 3 months above, is most probably viral infections, where child keeps crying, tug at their ears. They just touch and keep trying. Whenever you touch, they will cry excessively, or they tug at their ears, and they make unusually shrill cry they'll have. Fever will be mild to moderate, and they might have irritability, little vomiting in a little older group. But a toddler can point out at pain, saying the baby has pain, or they can even see a discharge coming out, or even a slightly older child might even complain of some kind of block in the ear, or kind of tinnitus, we call ringing sensation in the ear. If it is too bad, they might have dizziness. These are the symptoms which an older child can point out at. So once they come to the hospital, after any child, we generally look into all the systems, and also ear is one of the part of general physical examination. So when we have an instrument called as otoscope, we look through the ear and see if middle ear is inflamed by seeing a tympanic membrane, which is usually a pinkish, will become little grayish, or there may not be properly illumination, which normally happens like a transparent membrane it is. And there might be even perforation. Perforation means a hole. That there is one pneumatic otoscope where we push in air and see if tympanic membrane is moving or not. And very rarely we do investigations like blood tests for a child who is older, because in this we can wait and watch, and child is able to tell you the symptoms. But in a very small baby, we do investigate and see with lab workups. And when we do investigation, sometimes the otitis media, like in foreign countries, they might say wait and watch. Thing is okay, but in our country, as we see lot of chronic otitis medias, for us we give 2 days time. If pain reduces by itself with symptomatic measures which we give, like paracetamol or anything, or painkillers, ibuprofen, then most of the viral cases might subside, but we need to call them once in 24 hours or 48 hours to look into the further progression is happening or not. Second thing is otitis media with effusion. With effusion means there is some fluid in the brain which can cause hearing, little difficulty in hearing, as if something is blocking the ear. They keep tickling, they keep doing this, and when they yawn or do, they get pain because some movement is exaggerating the pain symptoms. There is something called as a chronic otitis media, where if the child is getting this purulent discharge, which is happening once at least 3 times in 6 months, or 4 episodes in a year, we call it as chronic otitis media with effusion. This has to be really dealt with special investigations, because if child is getting repeated infection, if your tympanic membrane gets scarred, and those ossicles, there are three small bones which are connected to the inner ear, which is there. That is the one which carries the nerve impulses to your brain, which makes you hear. If these ossicles get damaged because of these repeated infections, child will have hearing deficit. And especially they have done a study, if the child has got chronic otitis media less than a year, definitely some of the consonants, some of the syllables, they are not able to pronounce as good as a person who has sample whatever is coming out of the ear for test to see which bacteria, and according to the sensitivity, we do treat accordingly. Some babies, what they do, over the counter, they have heard of these infections from their, as I told you, family histories, and so many parents and grandparents have harm than doing good, because chronically you're putting antibiotics to the ears, the drug might become resistant, bacteria will grow more and cause more problems than doing any good. So I would advise, if the child is having recurrent ear infection, please do not ignore, go to the pediatrician or an ENT specialist, get the test done properly, several investigations, so that baby doesn't end up in having hearing deficit or speech delay. The other common problem is chronic otitis media repeatedly getting is sometimes infection, because their immunity is so low. There are so many organs near the ear. There is a bone called mastoid which is behind your ear. Those ear cells are very prone to infections. So if you neglect, and if sometimes what they do, we are giving a course for 10 days. They don't give it for 10 days. They stop it in between. Once they stop, the symptoms come down, or fever comes down, child looks well, they stop it, and then again the bacteria can migrate to mastoid, which is a bone, and then it causes blood to go to your brain, causing brain damage. causing meningitis. Meningitis means infection of the brain, where child will have stiff neck, vomiting, irritability. So whatever we could treat with oral or topical applications, now it has become severe infection and it can go to brain and cause meningitis. Even sometimes it can cause the blood vessels to clot, and we call it as venous thrombosis in the brain. So I advise parents, whoever have chronic otitis media in your children, please meet a doctor and take proper course of treatment, trying to improve child's nutrition, vitamin supplements, and taking care of hygiene. All that is very, very important. The thing nowadays, one good thing which we see less number of cases is because we have come up with Hemophilus influenza B vaccine. This was one of the commonest cause of otitis media in the earlier years, and we also came up with pneumococcal conjugate vaccine. These vaccines have reduced, in fact a lot of cases have come down. Those who have not taken, I urge parents to go for it. And at least what we can prevent is by giving vaccination. This is the best too, because ear is everybody thinks that ear is not so important, but every organ in our body is important. And ear care, they use these buds which are more dangerous. Usually your our ear, children's ear, everybody's ear is protected by that wax, which is a cerumen. What people think is little cerumen also, they keep peeping into the ears. Little wax also, they think it is dangerous. Cerumen or wax is very protective. It is a natural phenomena for you to get rid of the bacteria or virus or a foreign body, because that acts like a lubricant for your ear, that prevents your any foreign body entering the ear. So don't have to clean it very repeatedly, especially using a bud. If you are using a bud with a cotton, the cerumen gets pushed. Usually, it is only in your external canal. It is not in the middle ear. So when you push it, you are going further inside, and you are pushing the cerumen inside near the tympanic membrane, and you are causing more harm. It may cause blocking of the cerumen, can get hard and blocked. So I advise parents not to use the buds. Whenever you give bath, make sure you use the blow dryer. You can use the blow dryer with low speeds to clean it up. Ask nanny or whoever is there not to blow inside the ear. Some have a habit of blowing inside the ear, which I strongly advise no. Common question I ask for parents from kids who go for swimming. Can they go for swimming, and how should they protect, and all? Because ear infection can get in, and the ear canal can get inflamed and cause severe pain when we touch. That is called as external ear canal infection. In that, swimmer's ear can be protected by cleaned and then given local antibiotics, and they can use the scabs, and then you plug the ear. Best thing is, if you are using a cotton ball with petroleum jelly, then put it. That acts like a water repellent. That can be done. Never use a sharp object to clean, like pin, hairpin, which we have seen several traumas happening. Age old and wax dissolvents are there, which are mineral oils or even coconut oil or even hydrogen peroxide, but don't use that. Now over the counter ear wax dissolvents are there, which we can use. So having taken precaution of all this, I think we can take care of ears. But if a toddler having several episodes of chronic otitis media is watching a TV, then you are calling him with low, if you are calling him with if you are calling him and he is not responding to a normal voice, and or he himself is talking very loud to you in a normal voice, when you are conversing with the child, if he is speaking very loud, also suspect there can be hearing deficit. In such cases, because of chronic ear infection, the ossicles might not be moving, so in that case also, or there is any perforation till then, just find it out. If there is chronic otitis media, we do refer to pediatric ENT specialist, where if there is fluid inside and there is too much of pressure created, we need to relieve the pressure. So what we use is a grommet. It's called as a small tube, and they insert in an OPD basis or slight. They sedate the child and put it in the tympanic membrane. That tube relieves the pressure and takes off the fluid which is there, and it prevents it from rebuilding again and again. So that is done by the surgeons. That can be done so that further problems do not happen. That grommet can fall off by itself, or sometimes we need to take it out. And Hemophilus influenza vaccine. This will take us long and help us to get rid of these common ear infections. Thank you. I have got so many questions. Can I answer? Yes, yes. Till what age does the eustachian tube is developed? Eustachian tube is already developed at birth, but it is the shape and the size which is going to, and the angle with which it is opening is going to change as they grow. By most of the time, by 2 years, it will be normal angle, but 5 years, 100% it remains like an adult. What are the concerns of a child with chronic otitis media? I already spoken to you. Chronic otitis media concerns are: one, they will have little, always something greenish or yellowish liquid oozing out of the ear, and they might have fullness in the ear, hard of hearing, dizziness, sometimes vomiting, tinnitus. Tinnitus means any ringing sensation in the ear, and because of hard of hearing, they might be able to hear, it's undetected, and child is not performing well in school now, and he is feeling shy to tell that he is not able to hear. He might not tell to parents. So that if get neglected, then he might have learning disability. In older children in age groups of 8 to 13 years, if the cold is not treated completely, will it cause any trouble? See, any child cold being chronic is most probably because of allergy. So allergy is in turn a need for otitis media also. Allergic kids will have always inflammation in the upper airway. That inflammation hinders the flow of fluid from middle ear. That itself acts like a focus for the bacteria to grow. If it is just viral, need not give antibiotic, you will be treated even in 8 to 13 years. But if it is going on with greenish mucus, cold, always blocked nose, headache, which might be going into sinusitis. So any child 8 to 13 years, if the cold is longer, it might end up in sinusitis. That sinus with can cause postnasal drip and cough, and those things can cause trouble. Otherwise, allergic rhinitis, avoiding allergies, avoiding dust in front of them, or cleaning keeping the room clean doesn't cause any ear infection trouble. See, there is gentle closing of one nostril and gentle blowing and gel neti and all for a bigger child can be taught. But if the ear tube is blocked, we can do that Valsalva maneuver, like holding your nose, pinching it, closing your mouth and blowing. But blowing very hard, very fast means can cause too much pressure difference in the ear canal, and it can cause pain suddenly. But it will not cause any perforation to happen. But loud noise, sudden trauma, those things have shown to have caused perforation. But blowing nose, if it is too fast or too harsh blowing, can suddenly hamper the pressure inside the ear. But that can be solved by doing Valsalva maneuver. That is closing and blowing through your mouth. Will blow. Who should I see if my child is suffering from otitis media, pediatrician or ENT? Whoever stays close by, you can go. Otitis media with acute and chronic we treat. But as I told you, chronic otitis media which are having problems like chronic perforation, we will refer to a specialist. Ma'am, no more questions. Okay. Thank you. Thank you one and all. I hope it was of some use. Done?
Thank you so much, ma'am. Thank you so much for a wonderful session. I will end the broadcast now. Thanks.
Okay.